Yes. Okay, so now we're going to talk about trying to improve the hip's ability to stay on axis in the frontal plane. So going ADduction, ABduction. The first direction I'm going to talk about is into ADduction. Now, when we mobilize into this direction, typically the person that would benefit most from this is someone who has more of a arthritic hip that needs a little decompression, a little bit of gapping. So we're going to do some gapping combined with ADduction. So there's two ways to do this. The first one I'm going to show you is with, you could use a whole foam roll. For me, I just have two of these half foam rolls put together, stacked, and we're going to bring Kay's leg back and off kind of the back of the table. And then I still want her pelvis to stay stacked. Most people, if you do this, they're going to want to rotate their pelvis back. Don't let them. Be in control. Because the therapist needs to be in control, at least to start with. So now we're in this position. Everything is in a nice line. I have the foam rolls as close to the joint line as I can get. Then I'm bringing one hand up onto the lateral aspect of the iliac crest and just blocking that so that this is not a pelvic girdle motion. This is a hip motion, okay? So I'm blocking the superior portion of the iliac crest, and now I am taking the leg down into ADduction. The foam roller is creating a little bit of a fulcrum to create some of that gapping. And then from here, I can add a functional mobilization or contract, relax. So hold here, Kay, don't let me push you down. I am tractioning long through my arm, like towards her foot, and let it go. Good, I'm blocking her pelvis as I try to take up some slack here. Hold there, don't let me push you down. Tractioning here, and let it go. So that is one option with the half foam, or with the foam roll. Bring that back. Also, I could get a bit more aggressive or specific with the belt. Sometimes the belt can be uncomfortable from a pressure standpoint. You could fold up a towel or something like that and put it between the belt and the inner thigh. But, okay, we're gonna bring that back. Good, I'm gonna come all the way as close to the joint line as I can. I use kind of the front of my left hip here to block her pelvis from coming back so I don't have to control that with any of my hands. Now I'm taking her leg into the same position. Now that I'm have a better block on the inside of her thigh, she can't go into as much ADduction before she engages the belt. So I'm still gonna block the pelvis here, but I have a lot more control in this position. And now don't let me push down. I'm still tractioning through my arm that I'm providing resistance with, and let it go. And then as she lets it go, I'm kind of pivoting my trunk and kind of lifting, standing up through my left leg, lifting up a little bit through my left shoulder to create a little bit more gapping in that joint. And then go ahead and press up again, Kay. And let it go. But I'm trying to really stand up through my entire body. I'm not trying to like shrug my shoulder up. So I think that's an important differentiator there. It's really kind of like a weight shift and stand up through that left leg. Lift up there, Kay. Good, and let it go. Okay, so that's how, two options for how I work on improving the ability for the hip to stay on axis in the frontal plane in adduction.